Iron deficiency anemia is one of the most common blood disorders in Malaysia, as we have many Malaysians suffering from iron deficiency anemia. What happens is patients have got reduced amount of iron in the body, which is an important molecule that is required to build the haemoglobin, which is actually our red blood cells. Hemoglobin is required for day-to-day cell functions, for example, in terms of cardiovascular and also metabolism and also our day-to-day activities and so forth. The red blood cells carries oxygen in our body. So therefore, when you have less iron, you tend to produce less hemoglobin. And that basically reduces the oxygen carrying capacity. Basically leads to patients having symptoms of anemia. For example, patients will usually start off with having giddiness and headache, lightheadedness, and they also have generalized tiredness, lethargy, shortness of breath, especially on exertion. Then when the anemia develops even further, patients tend to have palpitations, sometimes chest discomfort, to an extent where patients can even have syncopes or fainting episodes. Other complications they can have, frequent hair falls and also other symptoms, for example, leg cramps and so forth. Now, who are at risk? We have got different categories. Young ladies in their childbearing age who have heavy menstruation, people who have got very poor diet, meaning that they do not eat enough iron-rich food. We have patients who have got GI symptoms, gastrointestinal symptoms, for example, due to absorption problem. Also patients with heavy bleeding, for example, having stomach ulcers or bleeding haemorrhoids. We also see patients who have got frequent blood donations as well. So given the fact that iron basically is the building block of the red blood cells, which are the hemoglobin, and as we know, hemoglobin is basically the fundamental of carrying oxygen molecules to our whole body system, it is important to recognize iron deficiency anemia and get it treated early.